have a report of a multi-vehicle accident with injuries.
This training video will demonstrate generic medical practices on how to properly handle and manage patients who are potentially contaminated with radioactive material. The techniques demonstrated in this video are generic in nature and are in no way intended to replace your local response procedures. Understanding these techniques will help you, as a responder, function with confidence during incidents involving radioactive material. As a responder, you encounter many kinds of emergencies entailing varying degrees of risk. All emergency situations are potentially dangerous, and some may be complicated by the presence of hazardous material. Attempt to identify the mechanism of injury or the nature of illness. Look for these conditions to determine if the victim has life-threatening injuries and immediate transport is necessary. Unconscious or altered mental status, respiratory arrest or distress, severe hemorrhage that cannot be controlled on scene, or poor perfusion or associated signs and symptoms of shock. Intubation of the patient should not be performed in the hot zone unless unable to secure airway by other means. Take protective measures not to introduce inhalation hazards to the patient. Maintain endotracheal tube sterility as trained. Intravenous cannulation should not be performed in the hot zone. Cleanse the selected site thoroughly using alcohol or betadine. Remove outer gloves prior to intravenous cannulation. Take protective measures not to introduce hazards intravenously. Administer fluids as directed by local protocols. Give a brief but informative description of the patient's condition. Alert hospital of possible contamination and material involved. Identify the number of patients involved in the incident. Transport patients to the appropriate medical facility, and consult with hospital staff for any specific arrival instructions, including alternate arrival entrances, hospital radiation safety support, and unloading of the patient. To prevent the possibility of internal contamination, responders should not eat, drink, smoke, or chew. The ambulance crew and their equipment return to regular service only after they have been surveyed and decontaminated if necessary. By employing these procedures, emergency response personnel can adequately care for the needs of accident victims while affording maximum protection to themselves and victims alike.